You just gave birth. Congrats, mama. Right after birth, there are a few critical things that you have to consider. Will you delay cord clamping? Will you do vaginal seeding? What is that? Will you give your baby Hep B vaccine, vitamin K shots, eye ointment? Will you delay bathing? Today, we're going to discuss that and more. Hi, I'm Stephanie, aka The Healthy Practitioner. This is where we talk health, wellness, and all things detox. So let's get to it. I help hundreds of women balance their hormones, get perfect birth plans, and hopefully have a healthy, empowered birth. So first, let's talk about delayed cord clamping. Why do we even do that? So it's becoming more normal for hospitals and other settings to have this as an option and just as a standard of practice. But prior, there were many years that right as the baby would come out, they would cut the cord and be done. Well, that cord has up to 1/3 of the baby's blood supply in it. So it's important to let it pulse and get into the baby's body. It also has up to 75% of the baby's iron stores that can last them 6 months to a year of life. 75% of their iron stores. Guys, iron's important for all processes of the body. So letting the baby get all of that is important. Lastly, and one of the most important things, baby just went through trauma. They just, whether it be C-section or vaginal birth, they just went through a lot. The umbilical cord, we know, contains a lot of amazing stem cells that actually go through the body and repair any damages that happened during birth. Our bodies are pretty darn amazing. So let the cord pulsate until it's complete. I say minimum of 3 minutes. Let it be attached for 20 minutes. It doesn't matter. It's not going to hurt the baby by being attached. They put the placenta in a bowl and they can let the baby chill. You're holding the baby, not taking the baby away for anything if there's not an emergency. Let the body just rest and let all of that goodness go in. For sure, you're going to wait until it is pale, not blue, and obviously not pulsating. But for me, I say the longer the better. Next, vaginal seeding. So let's say you had a C-section, whether it was planned or an emergency. This is something that I love having in my birth plans. Typically, the benefits of going through the vaginal canal, there's quite a few, but one of them is the vaginal seeding. So when the baby goes through the vaginal canal, they get the mom's amazing vaginal microbiome, which helps with protection against allergies. It helps enhance immune function. So if the baby's getting delivered via C-section, they're losing this. But you can opt for vaginal seeding. So they just take a swab and they will swab the mom's vaginal canal and then they'll put it on the baby's lips, their skin, their face. They will get the baby inoculated with that vaginal microbiome. It's such a helpful tool. Discuss that with your provider. If you're anticipating even a home birth or a hospital regular vaginal birth, always keep that in the back of your mind. If something happens to where you do have to go and get a C-section, that they know that that's something that you want. All right, now we're going to get into the controversial stuff. So let's talk about eye ointment. Mom, do you have STDs? You must. You must have STDs if you're getting your baby erythromycin eye ointment, right? Oh, you don't? Okay. Well then, erythromycin eye ointment is something that you can decline. So that erythromycin eye ointment is an antibiotic that they put on the eyes. It's like a gel-like substance, and it helps prevent against STD. The hospital system just assumes that every mom has STDs and gives every single baby the eye ointment unless the mom declines. So if you're not one of the moms that may have an STD, you can opt out of giving your baby ointment. Or if you're not quite sure, get tested. If it's negative, you don't have to get the erythromycin eye ointment. We don't want to give our babies unnecessary antibiotics if they don't need. Not only that, giving them goopy eyes when they're just entering the world is just an intervention train that's just starting and not ever stop. What about the Hep B vaccine? You do drugs, right? You must. Oh, you don't? You don't leave dirty drug needles laying around your house? Oh, okay. Well then, I got good news for you. You don't have to do the Hep B vaccine for your baby. Again, it's your choice. You should always do the research. But if you do the research, it's kind of like the erythromycin eye ointment. We just give it to every baby for the small percentage of the babies that could be of that increased risk for hepatitis B based on drug usage or their parents. A lot of times, Hep B antibodies will wane during time. And if you don't foresee your baby having an immediate exposure and they're not in danger of getting hepatitis B from typically drug using needles or things like that, then you can look and you can opt out of doing that. But I will say that anytime we use a vaccine, there is an adjuvant inside that vaccine. The adjuvant is a cellular irritant and toxin. Usually it is a heavy metal or it is something like formaldehyde. It's something really abrasive to the immune system so that it gets it to respond to the virus or whatever is getting injected into the body. So if the baby's body is not developed enough, their immune system can have a hard time controlling that immune response, and secondary things can happen, such as allergies, such as major skin eruptions, such as autoimmune issues. There are things that can happen secondary. We won't go into those right now, but it's a discussion that we need to have in the future. And if you don't feel like you have that risk, then that's something you can consent to. I will give a disclaimer in consenting. I watched many years ago, my girlfriend had her baby and I was in the room and she was having contractions every 1 minute. She was definitely in labor. And during every other contraction, when she was coming out of it, a nurse would be right next to her face having her sign consent forms for vaccines, for all of these procedures that were going to be done. And I was like, that's actually not informed consent because she's in la la land. She doesn't even know I'm here or exist. So just make sure that when these things are happening, that this is a plan that is made beforehand so that you're not having to sign consents during the laboring process. Okay, 3, the vitamin K shot. So I think that this is a really good one because there are some instances that patients, moms will opt for getting their baby a vitamin K shot. There's more risk for bleeding. It's to help prevent bleeding. The baby has low vitamin K at birth. There's different theories on that, but really one of the biggest theories is that all of the stem cells that are in the umbilical cord, there's low vitamin K so that the blood is thinner and that the stem cells can get to the places of need and help repair. And then the mom's colostrum has tons of great vitamin K to help replenish that lower supply. So giving synthetic version of vitamin K, which typically has artificial ingredients like either benzyl alcohol, it could have some PEG in it, usually something irritating to the system, can do the same thing that I just talked about with vaccines. It can be an irritant to the immune system and it can produce an immune reaction. So it's one of those things that you have to weigh the pros and cons. Is there potential that they're going to drop the baby and there can be blood, like internal bleeding? Is there a risk for circumcision with boys and bleeding with that and just general spontaneous bleeding? So you have to look at risks versus benefits. There are oral supplementation. I know when my brother and his wife had their baby, they actually offered it at the hospital to do oral vitamin K. Again, they use synthetic forms. You can go on different sites and get healthier, natural versions of vitamin K, but there are oral dosing schedules that you can follow if you do not want to do the injection. Again, it's your choice. You have to be informed. Listen to the pros and cons of each side, because if someone's only giving you one side and saying, if you don't get this, your kid will have XYZ, that's fear mongering and it's not the whole story. So I'm here to empower you to make you have the best decisions for your family because you know best. One thing that I know as a mom is that the mom intuition is nothing to put aside. If there's this gut instinct that's like, oh, my baby, I don't want them to have this, please listen to that. Take a step back. You can always put something in a baby. You can never take it away. So just make sure that you are listening to your gut either way and going with that, because ultimately you have all of the answers. Okay. Lastly, we're going to talk about delayed bathing. Keep that immune boosting vernix. So the baby's born. A lot of times you'll see white vernix on the baby's skin. It's like a shea butter for babies just giving birth. It's amazing. It protects against bacterial infections. It regulates body temperature. It helps with bonding and breastfeeding. So actually having that as the barrier is good. With Lainey, I ended up being hospitalized 5 days after my home birth. So we didn't end up doing her first bath until day 14. And she was fine. She didn't stink. She didn't have crusts all over her. Like she did just fine. So keeping that vernix on, gone are the days. And I don't really think a lot of hospitals are pushing a bath right away. And a lot of times that's just the hospital regimen is for people that may not have the resources at home to be able to wait or be able to navigate on their own. Just like formula feeding. And that's again a whole nother topic that we'll get into. But your baby doesn't need formula when they have a hospital birth. Their stomach is the size of like a folate or an olive would be a good, like a black olive, the first days of life. Like they need the drops. So that's why mom's colostrum, those little drops, are the most important thing for the baby, because that stuff has coating in it that's just eliminating all of the junk that is in the baby's system that came from them being harbored in your body for 9 months. That's why you get the black tarry stools for the first few days, because that colostrum is just cleaning out their system. And then your milk comes in on typically around day 3, and that's when the stomach starts growing and they start needing more food. But to plop a formula bottle in their mouth right after birth is typically not necessary. So all that to say, hospitals are amazing. They do a great job for the general public, but when you want more and you really want care that is individualized for your baby and your family, you have to take control. And that's where a birth plan comes in, and that's where just this extra knowledge comes in place. So mama, birth is overwhelming, and having a plan can make all of the difference. Whether it's delayed cord clamping, vaginal seeding, understanding your options with erythromycin, Hep B, vitamin K, delayed birth bathing, all of those things can have an impact on your baby later in life. So you get to choose, you get to be empowered. I hope to see you back here soon. Have a good day.